This lesson is on medications. So I've started by trying to group some of the more commonly used medications in the cath lab. So we have chronotropic agents, antiarrhythmics, and vasopressors or vasoconstrictors. So starting with the chronotropic agents, you need to know what that term is, and those are drugs that can change the heart rate. So there are positive ones that increase heart rate, such as atropine, and then there are negative ones that decrease heart rate, such as beta blockers. Then there are antiarrhythmics, and the most commonly, when you think antiarrhythmics, you should think amiodarone, lidocaine, and magnesium. There are others that treat different types of arrhythmias, but these are the three most commonly used. Um, we'll talk about amiodarone and lidocaine later, but right now magnesium, know that it is only used during hypomagnesemia or Torsades de Pointes. So, and that's the only time that I talk about magnesium in this lecture. Next are the vasopressors or vasoconstrictors, and of course they cause constriction of the blood vessels, which increase blood pressure. And then most common ones are epinephrine and vasopressin. Now we're going to talk about specific arrhythmias and the drugs used to treat them. So first we have symptomatic bradycardia. For that, you start with a dose of atropine 0.5 milligrams IV or dopamine 2 to 20 micrograms per kilogram per minute IV. The next one is symptomatic supraventricular tachycardias, and for that you would start with a dose of adenosine 6 milligrams IV. Atrial flutter would require cardioversion, and you will begin at 50 to 100 joules, whereas AFib requires 120 to 200 joules. Asystole or cardiac arrest, start with epinephrine or vasopressin. So epinephrine would be 1 milligram IV. That causes vasoconstriction, which shunts the blood back to the coronaries. It increases the heart rate, increases heart contractility, and so you start with the dose and then go to infusion, which would be 0.1 to 0.5 micrograms per kilogram per minute IV. Or you could use vasopressin 40 units IV. This causes, again, peripheral vasoconstriction, which shunts blood back to the coronaries. So they work in the same manner. Next, we have refractory or recurrent VFib, VTAC. So what that means is, let's say we shock them and it doesn't correct the rhythm, then it's a refractory VFib or VTAC. Or let's say we shock them and it does correct the rhythm, but then they go back into VFib or VTAC. That would be recurrent. So refractory or recurrent, you can give amiodarone 300 milligrams IV or lidocaine 1 milligram IV. The next arrhythmia we're going to look at are the PVCs. PVC is premature ventricular contraction. That's where the ventricles contract before the atria. And here's what one looks like. So here we have a normal rhythm and then all of a sudden a PVC. So these can be spontaneous, which mean they occur for no reason, or they can be caused by the catheter. The catheter tickles the ventricle. If these are recurrent, lidocaine can be given. So think about it, a lidocaine we think of as an anesthetic, and it works in the same way with the heart. When it is injected into, let's say, the left ventricle, it can kind of numb the heart a little bit and cause it to not be so sensitive. Okay, so those were the arrhythmias and the medications that treat them. So moving on now to different types of medications. The analgesic is a pain reliever. Narcotic is a strong pain reliever. Some common ones are morphine, which 2 to 5 milligrams IV per dose, or fentanyl. Keep in mind that fentanyl is 100 times more potent than morphine, so doses are in micrograms. So you would use 50 micrograms IV per dose. Anticoagulants and platelet inhibitors, kind of grouped them together a little bit. Anticoagulants prevent bloods from clotting, and those are considered your blood thinners, whereas a platelet inhibitor prevents platelets from sticking together. So they work in a little bit different way, but they're both considered blood thinners or anticoagulants. And they are heparin, Coumadin, Lovenox, Angiomax. Your platelet inhibitors, we got aspirin, clopidogrel, which is Plavix, and the 2B3As, which are Riopro, Integralin, Aggrastat. Moving now to the thrombolytics. Now this is when there already is a thrombus, there already is a blood clot, and you need to break up that blood clot. So these dissolve blood clots, for example, in DVT, deep vein thrombosis, or pulmonary embolism, or a myocardial infarction. So these, keep in mind, these are contraindicated in patients with active internal bleeding, and some of the common ones are streptokinase, TPA, which is alteplase or Activase, and Retaplase. Antibiotics treat infections caused by bacteria. Some common ones are vancomycin, Ancef, amoxicillin. Vasodilators, these make blood vessels bigger. Nitroglycerin is a big one, treats angina pectoris. And then there's verapamil, which is a calcium channel blocker. Antiemetics, these prevent vomiting. You have Zofran and Reglan. Beta blockers, so all of these end in LOL. These slow the heart rate and decrease blood pressure. So atenolol, metoprolol, and labetalol. Calcium channel blocker, these dilate blood vessels and decreases blood pressure. So these both decrease blood pressure, both beta blockers and calcium channel blockers decrease blood pressure, but in a different way. The beta blockers slow the heart rate, whereas calcium channel blockers dilates blood vessels. The most common of those is verapamil and cardizem. Moving on to sedatives, these cause drowsiness. So Versed, Valium, lorazepam or Ativan. Diuretics, these increase the urine output, and Lasix is the common one there. Contrast pre-medications. So the way I remember this is a pre-medication is the prednisone. So they start with the letters PRE. Contrast pre-medications would be prednisone and Benadryl. Whereas if the patient does have an allergic reaction and what to do after the fact, that would be epinephrine and Benadryl. So both of these would indicate Benadryl, but your pre-medication would be prednisone, which is a steroid. But if there is an allergic reaction, you can give epinephrine. So that is a very quick overview of the medications that are listed on the ARRT content specifications. And the best way that I would suggest would be to make flashcards. Hopefully I can get that done and put up on Quizlet, but until then the best thing to do would be to make flashcards to strengthen your knowledge in this information. There's a lot here.